Hello, citizens of Berwyn. This is Mayor Lavero, and I want to thank you for joining us for the special feature in honor of Black History Month. The city of Berwyn honors this special acknowledgement annually to coincide with the annual themes. The theme of this year's observance, Black Health and Wellness, explores the legacy of not only Black scholars and medical practitioners in Western medicine, but also other ways of knowing, such as birth workers, doulas, midwives, naturopaths, and herbalists throughout the African diaspora. The 2022 proclamation can also be viewed on our website at www.berwyn-il.gov under the View Agendas Quick tab, unanimously passed on the February 8th, 2022 regular City Council meeting. With us today to talk about what it means to be a Black medical practitioner is McNeil Loyola's favorite doctor, Dr. Tamajah Jordan. Good morning, doctor.
Hello, Mayor Lavero. It is definitely a pleasure to speak with you today. Thank you so much for having me.
I know how busy you are, and you must be, and I sincerely thank you for taking the time to share a bit of your journey. And I know your story will have a big impact on our viewers. So I need to ask you, how did your journey as a healthcare provider begin?
Well, I'm originally from New Orleans. I actually went to a historically Black college called Xavier University of Louisiana. Prior to that, I really enjoyed my biology class in high school, and that really prompted me to pursue medicine. I actually thought I would be a teacher. um, but I basically had always had this interest and desire to help those in need. Um, During my undergrad career, I interviewed at a lot of different schools for medical school and decided to go to Emory School of Medicine, which is in Atlanta. And I just felt very welcomed. We had the largest class of graduating African American docs when I finished in 2004. But it was just a wonderful environment. I worked at the county hospital there called Grady Memorial, um, where I got to see a wide variety of patients from all different ethnic backgrounds, community settings. It just really um, confirmed my interest in working with those in need. And then after medical school, I moved to Ventura, California, about an hour and a half north of LA, and completed my training in family medicine at the Ventura County Medical Center's family medicine residency. And I was chief resident there during my last year. There's a very large population of Latino, Hispanic patients who live there, and I was able to take care of them. I do speak Spanish, and knew that I wanted to continue to serve patients who sometimes can't access the medical community just because they don't have the English speaking skills. So but while I was there, I was a part of our minority um, recruitment and retention committee through my residency program. And one of the things that we did every year was we held a like free flu shot booth that we did every year at the local farmers market, and that was just a wonderful way to get to meet a lot of the people in the community.
Well, I can certainly understand what growing up in a rapidly changing community is like. I've lived in Berwyn for 61 years, and watching as a young person and an adult, you see how your community evolves and how it evolves you also.
Yes.
But let me ask you, how has the diversity of the communities you have worked for impacted your approach to healthcare? And what ways can the healthcare institutions embrace the many cultures, ethnicities, and beliefs people bring from all over the world?
Well, so I finished my residency in 2007 at VCMC and moved here because I wanted more diversity. I wanted to be able to care for patients from all different backgrounds. And one of my passions, excuse me, has always been in OB care or obstetrics. So I moved here to Chicago and excuse me, became a maternity child health fellow at the West Suburban Medical Center back in 2007. I was blessed with that opportunity. Actually, was able to direct the fellowship for about 5 years before I was blessed with the opportunity to actually serve as a director of one of the federally qualified health center sites that I worked for. Um, I strongly believe that we should take care of our patients regardless of their, ethnic background, their, ability to pay, whatever barriers are may prevent them from getting the care they need. And we, have to accept and honor people where and meet them where they are. It doesn't matter where you're from. I currently am on faculty here at Loyola McNeil in the Family Medicine Residency Program, and I've been here for almost 5 years. And it's really been a blessing to be able to teach. One of the other things that's really near and dear to my heart is my ability, my passion for medical missions trips. I'm an international missionary, and unfortunately, the pandemic has stopped a lot of my ability to travel. But
Sure.
I've really had an amazing journey to several countries like the Dominican Republic and Haiti and Puerto Rico, India, just amazing places where it really has helped me to um, get a better appreciation of how different people from different cultures and countries feel about medicine and how they access it or why they don't access it. Um, and so for me, I think just my journey has really helped open my eyes to the struggles and the questions and sometimes the apprehensions that people have. And then my duty is to really impress upon the residents in family medicine who I train here to really take a second look and to slow down and to take some time to understand their patients and what their concerns are. Maybe it's something that's culturally related, maybe it's a faith-based issue. Maybe, there may be many reasons why people access or don't access the healthcare system. And so it's our duty to investigate.
Sure. And my wife and I have traveled to some of those countries also, and it's a different lifestyle in most of those countries. But I understand that, and you mentioned it, that your faith is very important. How do you embrace your beliefs in your work?
It's for me, I start every day, you know, talking to the Lord about my patients, talking to Him about, how am I going to be a light? How am I going to be able to be a blessing to others, and not just patients, but the residents who are in training, the faculty I work with, the staff I work with, and really, for me, it's the understanding that my faith and my ability to practice medicine definitely can coexist. So I actually went to ministry school at
Oh,
the Living Word Christian Center several years ago, and my purpose was really just to learn more about, okay, is that even possible? Because I've met so many people who through my faith walk, have said things like, well, Tamajah, like I trust God and I know that He's going to take care of me. So I don't want to go and get a colonoscopy, or I'm not going to go and get vaccinated. I'm not going to do, any of these things. I've had several friends whose husbands, for example, I don't know why it tends to be a lot of men, but, they'll, say, hey, I'm standing on my faith and I don't feel like I need medical care. And I um, know that, based on my training, my experience, I know that God has given us doctors, that God has given us nurse practitioners and nurses and wonderful people, therapists who are all here to help. And there's nothing wrong with coming to the doctor, even if it's for an annual physical, even if it's just to get, your screening colonoscopy. I think about, African Americans and just how we have such high risk for things like high blood pressure, colon cancer, prostate cancer, all of these different things. And if we don't know, how can we truly prevent disease? How can we truly say that we're taking care of ourselves? Because our faith, it's not just, the belief and prayer and fasting and all of that. It's taking care of the temple that in which the our Holy Spirit resides, so that includes
yeah.
wellness. That's, getting proper sleep, getting those annual physicals and wellness checks, that pap smear that some women are a little apprehensive to get every few years. But that our temples are sacred. And as a Christian physician, it's never that I push any of my beliefs on any patient. It's just that I allow myself to put myself in patients' shoes. I pray for them. I try to understand their perspectives so that at the end of the day, I can say that, okay, all their questions are answered. If they are struggling, with their faith or trying to figure out if they're going to get a test done or not get a test done, I'll sit with them and I'll say, okay, where are you in this? What do you feel God's telling you to do? What do and we just kind of work together. And that has always meant the world to me, and I love what I do.
And I had the opportunity yesterday to attend a Black ministry here in Berwyn, and it was very amazing with respect to their belief in God heals. And you've now explained how faith and medicine can coexist. So that's very important for us to recognize. But let me ask you further now. What's the future for Black health?
It's now in this day and age, I think that technology has, especially in the pandemic, technology has exploded. And there are so many ways now to access your doctor. Like I, for example, have telehealth visits scheduled tonight, where I can just like you and I are talking, I can talk to patients.
Yes,
Um, and we weren't able to do that before. So for me, it's reaching people in their homes. It's using things like this platform and using everyone's not on Facebook anymore, but TikTok and all of these cool apps, to really be able to reach everybody to say, hey, there's nothing wrong with taking care of yourself. And if you don't have insurance, there are plenty of places you can go to get that care. Federally qualified health centers like Alivio Medical Center in Berwyn. There's so many amazing places. PCC Community Wellness in Berwyn. Like
yes.
just amazing places with amazing people. And of course, Loyola McNeil. Why not? We're not a federally qualified health center, but we would love to take care of you. And I think also,
Well,
one thing for me that I just wanted to share too is just the importance of those of us who are, physicians, attendings who are teaching is to really embrace those docs of color who are coming through, like that pipeline
sure.
vision too, to say, hey, have you thought about staying in Berwyn? And, if you're from here, if you're from the neighborhood, and really letting your neighbors and your friends and family see, what it's like to, to be a doctor of color, to work in a community where there may not be many of us, to set the example and to really provide that sense of hope too, because who knows which kiddos we've taken care of or I've taken care of who may have never thought about medicine until they met someone like me,
Sure,
and
sure.
I may never know that, but I'm just thankful to
But
be.
you know that feeling's there.
Yeah, it's a wonderful feeling.
Well, Dr. Tamajah Jordan, thank you once again for sharing your journey to our city of homes, Berwyn, and for your service to our community. You can see the doctor's bio and information on McNeil's website, which link is shown on the screen here today. We've enjoyed the live stream shared throughout the month from our county and local leaders on our platforms. But Dr. Jordan, thank you so much for sharing your views with us today.
Thank you, Mayor Lavera, for having me. It's an honor, and I hope and pray that you are safe and well, and it is a pleasure to see you. Thank you, everyone.
Pleasure's mine. Thank you.